Oops, I'll wait for, there we go. I will call the meeting to order. Counselor Boga, will you lead us in the Pledge of Allegiance?
I'd be honored to.
States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Katie Gargano is the recording secretary. Would you like to call the roll, please?
Counselor Hildreth.
Present.
Counselor Susie.
Here.
Counselor Hoffman.
Present.
Counselor Haynes.
Here.
Counselor Bogert.
Here.
Counselor Conan.
Here.
Mayor Boards.
I am here. We also have the city manager, Kirk Biotti, in attendance, as well as Glenn Smith. Oh, so first on the agenda is the acceptance of the minutes from the previous meetings. The meetings of Laconia City Council of March 9th, 2026 were distributed to all members. With no corrections or changes submitted to the clerk, the minutes will be accepted as distributed. Councilor Conan, seconded by Councilor Bogert. Everybody had an opportunity to review them. All right, all in favor? 6-0. Next up, we have consent and action items. A request has been made to hold Laconia Bike Timber Fest on September 11th to September 13th, 2026, beginning at 5 p.m. on Friday, September 11th, and ending at 5 p.m. on Sunday, September 13th. Actual hours of operation for the event will be from Friday, September 11th, beginning at 5 p.m. and then ending at 2 a.m. on Saturday, September 12th, beginning at 7 a.m., ending at 2 a.m. on Sunday, September 13th, beginning at 7 a.m. and ending at 5 p.m. on Sunday, September 13th. The organizer of the event is requesting that the time for outdoor sound as shown above be extended to allow bands to play until 11 p.m. on Friday, September 11th and Saturday, September 12th. Bands will only play until 5 p.m. on Sunday, the 13th. So I move to approve TTO 2026-02, Laconia Bike Timber Fest, approve a waiver of all licensing and special event fees associated with the event, extend the hours of operation of sound, equipment, and all loudspeakers for Bike Timber Fest from 10 p.m. to 11 p.m. on Friday, September 11th, and Saturday, September 12th, 2026, and allow all alcohol consumption on city property in the designated areas only, pending special events review committee approval. Councilor Conan, Councilor Hoffman for a second. We are on to discussion. First off, I wish it was a better date than September 11th. I don't like having any events on September 11th. Councilor Susie.
I'm concerned with one section here. We've had some informals, or it's come up a couple of times. If it's for a nonprofit, we would waive fees. If it's for a profit, we would not waive fees.
I'm in agreement with that. We shouldn't be
Okay.
waiving
We
fees for
shouldn't
a
be waiving any
for-profit
fees
business.
For a profit organization. I know that they do a great job up there and everything else like that, but I don't think we gotta change that precedent, I believe. So I'd like to, depending on how I'd like to make the amendment that we don't waive the fees. I'm okay with the traffic order, but not the fees.
So we have a friendly amendment to not waive the fees,
Do we know what the fees are?
Yeah, right there, Mike.
150 and 200,
so $350.
so it's $350.
Where I was coming from is, a for-profit company, they should pay the fees, a nonprofit.
I agree. I accept that friendly amendment.
Councilor Hoffman?
Yeah.
You agree to that as well? So now we have the friendly amendment of still charging the $350 in fees. What was the breakdown on that, so we have it official? What was the
150 licensing fee and a special event fee of 200.
150 licensing?
Right, it's right there in
It's
the,
in there.
about three-quarters of the way down, Mr. Mayor.
Oh, I see it, yep.
Okay?
Any further discussion?
Now, the,
Councilor
if I
Bogan.
may,
Yep.
Mr. Mayor, we're gonna allow the drinking outside like normal with the containment area and stuff?
It's not a social district. at this
No, it
point.
isn't. That's, I agree with that part, it's not. But they're gonna get the proper licensing and stuff so that they can do like they have in the past and.
Yeah, it'll go through all of its, with liquor, with fire and code enforcement, all that, so it'll all be done properly.
My second concern is, they want to make it from 10 PM to 11 PM for the music. Have we had any public input regarding any of this?
No, and this is
Fellow
no change
buddies.
from years past.
Oh, it's no, okay,
That's why it's under consent action. There's been no changes to.
okay, I just saw that. It looked like it was being changed from 10 to 11.
But it was in the past as well.
Okay.
So, yeah.
Yeah,
Councilor Bogan.
thank you, Mr. Mayor. I don't think I've had any body complain about that from what I've heard, you know, through the different news outlets and stuff. And actually, I've gone up there myself and I've enjoyed myself up there and it's been pretty, it's fun.
I just wanted to make sure we didn't have any pushback from our buddies and neighbors that would. But
No.
obviously, if it's been done before, we're good.
They have police details that they're paying for. They gotta pay for all the trash and everything else like that, so I think it's pretty covered.
Okay, perfect. Any further discussion?
Mr. Mayor.
Councilor Haynes.
You know, to just all of a sudden say, okay, I mean, in years past, we've done this, okay? We've waived the fees. Now, all of a sudden, just because it comes up, we're changing the ways we've done business. I think it would be fair to them to say, from henceforth, going forward, people that are for profit, the fees will not be waived. But to all of a sudden just say, okay, now we've decided to change the way we do business. No, I have a problem with that, because they've always been waived.
I personally don't think those should have been waived to begin with, because if I went to an event, I'd have to pay the fees, and I'm not making
I think
profits.
we've, Mark,
Councilor Susie.
all I wanna say is that I know we've had discussions over the last year, you might say, when it came to budgets or dollars and everything else, that when this would come up again, because it doesn't come up very often. I'm not saying that what they're doing to the Weirs, there's other times, other organizations, we've said, we're gonna put a stop to this, or we were gonna to stop saying, okay, waiving all these fees. Okay, same thing for Bike Week, okay, for when, and I think Charlie, excuse me, Mr. Sinclair's here also, but I think we gotta, there comes a point in time, I can't expect the citizens of Laconia, the taxpayers, to absorb those things. That's my position on that.
And I don't, if I might,
course,
I don't have
Councilor
a
Haynes.
problem with that, but, I mean, January 1st, or set a date from now on, but just to, do you know what I'm saying?
I don't hear what you're saying, but
I don't think $350 is breaking the bank in anybody's
No,
pocket.
I don't either, but,
And I think it is good, it's, you know, it helps balance our budget, and it brings income to the city of Laconia. I mean, people are profiting from this event, so I think it's only fair that they pay an appropriate fee to the city. Councilor Hildreth.
Thank you. But this event is a neighborhood event. There are lots of businesses in the Weirs that are going to profit from this. So how do you, I guess, just the organizer has to pay it?
Whoever is putting their event together, just like any other event, whoever the organizer is pays the fees. Councilor Hoffman.
Well, I think, you know, we waive the fees for nonprofits, and if we waive the fees for events that bring people into the city, then what do we have the fees for? I feel like we're waiving them more often than they're actually applied.
Councilor Bogan.
Thank you, Mr. Mayor. And if I could just say that for over a year on the council itself, we have been discussing this, and we've asked the committees to stop waiving fees and stuff like that. So it shouldn't be a surprise to anybody if they pay attention to what the city council talks about during the city council meeting. So, I think if it hadn't been talked about so much over the last year and a half, then I might have that different opinion also, but
Can I make one more comment? Mr.
course.
Mayor? Okay, so earlier today, we had a Pumpkin Fest discussion. We get together every couple of weeks, and we're doing quite well so far this year. But even nonprofits, no fee waiving. Okay, for profits, we've collected a little over $12,000 so far, just some people that want to come and set up this year. So there's no waiving of any fees, okay? I mean, so, I'm just making sure you're aware of that.
Any further discussion? Counselor Bogart?
I think with this kind of income and stuff, that the council has seen the advantage of reinvesting the money and stuff, and that's what we've been doing, is reinvesting, trying to make everything a step above. And I think this is how we're doing it. If we waive all the fees, like you said, and then we're taking taxpayer money to reinvest back into the city, where this is taking events money and helping to reinvest back into the city. So,
Any further discussion? Seeing none, all in favor? And one opposed, 5-1.
I have a question.
We have to wait for the appropriate moment. A request has been received, agenda item 8B, temporary traffic order 202603, Wake the Lake. A request has been received to hold Wake the Lake on Lakeside Avenue on May 15th through May 17th, 2026, beginning at 5 PM on Friday, May 15th, 2026, and ending at 5 PM on Sunday, May 17th, 2026. It's pretty much the same details with different dates that we had on the last request. 9 PM, Sunday.
I have a couple of questions.
Okay, let me make the motion, and then I move to approve temporary traffic order 202603, Wake the Lake, approve a waiver of all licensing and special events fees, extend the hours of operation of sound equipment and/or loudspeakers for Wake the Lake from 10 PM to 11 PM on Friday, May 15th, 2026, and Saturday, May 16th, 2026, and allow alcohol consumption on city property in the designated areas only. Counselor Bogut, do I have a second? Counselor Conant, Counselor Susie, discussion?
I'd like to offer I have two questions, if you don't mind. The first
course.
one's to the city manager. Okay, on that area of Lakeside Avenue, are our meters enforced at that time, usually?
No.
They're not?
I don't believe we turn them on until Memorial Day weekend.
Correct.
Okay, that was question one. Question two is to offer that same requested amendment.
Friendly
that
amendment.
we don't do the waiver of fees.
Are both in favor?
Yes.
Do we have any discussion? I mean, we already had one on the previous.
I know
but-
that
Well,
Anthony has a question.
well, we could have him,
Not now?
yeah, I
didn't
think
know
we're in
we-
the middle of a voting
I wasn't
mode. We
sure
can't,
what-
yeah.
okay.
We'll have him, the next thing is, we'll have him come on next. Any further discussion? Counselor Haynes?
I don't want to be misunderstood. I'm not saying that we should waive the fees. I'm just saying that there should have been a time frame, so this just doesn't become a surprise item, okay? That's all I'm saying.
And I understand what you're saying.
I think we've gotten people too accustomed to waiving fees throughout the city for numerous events, and I think it's time to start collecting for the city, because otherwise it's falling on the taxpayers' back. This is money that's coming into the city that we can use. Any further discussion? Seeing none, all in favor? 5-1 again. Oh, six, I saw your hand go up, okay. All right, so now we are on to citizens' comments from matters not on the agenda. Anthony, if you want to go first, I mean, you were kind of on the agenda, but
I do have a question. I just want to know if I can charge admission to get into these events.
is that up to us?
I don't know, that's up to us. Is that, like a raffle or something else like that? I don't know.
You're gonna be charging admission for people to go onto city property, if you do that. So-
It'd be like, I'd like to want to set up a toll booth at Lakeside Ave on big, on
Bike
motorcycle
week?
weekend.
Well, like, I know you guys allowed it during, when I had a Blues Fest out on the beach, and I got the charge to go out on the beach, and I know that's a separate entity, kinda, I guess.
Yeah, I don't know, I think we're opening up Pandora's box here, a lot of questions. And I'm
Something to
sorry,
talk about,
the
I mean, we
city
have time,
manager.
I'm not going anywhere. But something.
That's something we could look into in the future. That-
I can add it to the list,
Yeah.
take a look at it.
We
And
could take a look into that.
Yep.
Anybody else with citizens' comments not on the agenda? And we're gonna keep these to 2 minutes.
Brought a couple, some weeding material, anybody who's interested. Good evening, and thank you for allowing me to speak. The reason I'm here tonight is this is documented in a recorded meeting, unlike the Building Code of Appeals meeting to be held on March 10th. Richard Mason. Many people may not realize that March 10th meeting was the first Building Code Board of Appeals meeting in nearly 12 years. And as a result, the board itself acknowledged that it was unfamiliar how the process should work. Before the meeting, the board held a 45-minute discussion, which they later learned they should not have occurred. The board apologized afterwards and explained to those present that they only had been discussing logistics. That evening, 3 members of the board were physically there, present. 1 member participated by phone, which we stuck in a trash barrel so everyone could hear it. Because by coincidence, the cameras and microphones were not functioning that night. And the meeting proceeded with only the building inspector's cell phone recording it, which had to be passed around the room. As the meeting began, I was completely blindsided to learn that the agenda had changed. Instead of addressing the substance of my appeals regarding the fire department's decision, the discussion shifted to whether I had met the 20-day appeal deadline for the original permit. For nearly 2 hours, the meeting consisted of almost entirely the debate of the 20-day filing period. The issue is that I had never been informed of this deadline in the many months leading up to that meeting. During that time, I had multiple conversations and meetings with the deputy fire chief, the building inspector, town manager, mayor, multiple city council members, and other city board members. At no point during those discussions did any city official ever inform me that there was a 20-day appeal deadline. In fact, I'm not even certain the city itself is aware of that requirement until legal counsel became involved. If the matter is truly clear-cut, why was a meeting scheduled at all? Instead of the meeting resulting in hours of wasted time for the members of the fire department, city officials, attorneys, board members, and members of the public, and cost me $125 to file an appeal. The current suggestion from the city manager is that I should sue the city. Let me briefly explain how we arrived at this. Initially, the deputy fire chief stated that he would not issue a certificate of occupancy for a building constructed approximately 6 feet from another structure due to safety concerns. However, after realizing the fire department had already signed off on the permit, the position quickly changed. I was told the department is not always given complete information when the permits are reviewed, and that they were likely not aware of how close the structures would be. At this point, I was told there was nothing further the fire department could do. Then I turned to the building inspector, who repeatedly advised me, get a lawyer. I asked a second question, get a lawyer. I had a third question, get a lawyer. That's how I was treated. I also spoke with local councilmen who expressed serious concerns about the project. I attended a city meeting where even the mayor voted concerns regarding the safety implications. So now, the recommendation from the city is that I must sue the city for failing to enforce its own regulations. There are several city codes that appear to have not been followed.
You got 30 seconds, sir.
City Code 235-35, minimum setbacks. A variance was approved to allow the building to move 44 inches closer to the road. However, Weirs Boulevard is specifically listed as a special setback area requiring buildings to maintain 50 feet from the center line of the street. Measurements from the front of the foundation to the street now are approximately 39 feet, 6 inches. This raises important questions. Was a 50-foot centerline setback required for the street specifically considering when the variances were granted? Fire code. This code requires minimum separation between structures for new construction. For a two-story construction, the minimum required distance between buildings is 25 feet. For this structure in question is approximately 6 feet from my home. Non-conforming use. Non-conforming use of a lot will not be increased. The gross square foot floor area of the building housing existing non-conforming use will not be expanded as a result of the replacement. It was expanded.
Thank you.
I have one last sentence.
One last sentence, thank you.
I understand mistakes happen. To err is human. But ignoring those mistakes, once they identified, is something very different. Allowing the building to proceed despite these concerns sets a precedence that could encourage other property owners along Weirs Beach to speak in similar variances, ultimately undermining the setback regulations that are intended to protect safety and planning of the community. All I am asking is the city to carefully review whether its own codes and safety standards were properly applied in this case. Thank you for your time.
Thank you very much.
Any questions? Not one, huh? I'm blown away.
Thank you.
Thank you.
Anybody else?
Hello, everyone. Can you hear me?
Yes.
I struggle with the height. Kristen O'Brien, Director of Philanthropy and Community Engagement for Taylor Community. It's been a couple of months since I was last here, so hello to the new faces. Really just here just to share some community updates, some great things, some great shows coming up. Just a reminder, we have our music series. Again, this is really more for the community, not necessarily all of you, but you're certainly more than welcome to attend to. But we do have a music series at Taylor Community. It is free to the public. Sneak peek for some of our April shows coming up. We have a folk and Americana performance on April 8th at 6:30 p.m. We have a jazz performance, Kat Faulkner, on April 12th at 3 p.m., and another folk performer, Alan Cook, on April 13th at 6:30 p.m. Anyone who is interested, please contact our Director of Resident Life for all 3 campuses. Her name is Carol Russell. For the purpose of the recording, I'll leave her contact information. It would be 603-366-1226. Or her email is crussell@taylorcommunity.org. Also, we publish a monthly newsletter, and all of our events, music series, our lecture series, again, those are all free to the public. Those are all posted in the Gazette. So if anyone is interested in receiving our monthly newsletter, they can call Sharon Ryba at 603-366-1400 and request a Gazette, and that will be mailed to you. That's it. Thank you.
Thank you very much. Anybody else?
Hello, my name is Erica Volmerding, Ward 5. This is my first meeting with the new mayor and the council. Thank you for being civil servants, good civil servants. I have 2 issues or concerns with some safety that's going on in Laconia right now. One may have been addressed. I'm unaware of it. I don't have kids that are school age. But there's an awful lot of school shootings going on across the nation. I think that we should have some school shooting, like fire drills going on. Every school that has had a school shooter said afterwards, We didn't think it was going to happen to us. There's kind of an issue that goes off of that one as well. All the kids say, you know, there were signs. Someone was talking about, how do you get a gun? Do you need a permit? I think that also if the police officers come to the schools and explain to kids the same thing that the police tries to explain to adults, and we don't do it either, to call 911 immediately. You're going to tell a parent, you're going to tell a teacher, you're going to tell a kid. But each school had said that there were signs with the child that shot up the school. The second one is we got an awful lot of bears in downtown. The last post was pretty scary. It was on Court Street, and the person said it's a pretty big bear. Take your bird feeders in. I only got into bird feeding last year. This is my second year. I put mine out too. I did some research immediately because I don't know anything about birds. And basically, you can put your feeder in or out at dawn and dusk for about an hour. I just recently worked for 6 months straight, so I haven't had a day off in a while, and that was a pretty long run there. But usually when I have a day off, I'm kind of like looking out, you know. All day they don't come. They literally come dawn and dusk. I recently spoke to someone who has a lot of bears at the house, and they said definitely don't leave it out overnight. And I don't know, like Mayor Boards, what you're doing with this council. I don't know how it goes. What I would like to do is have a city ordinance that basically says people can bring them out for an hour before work, before you go to bed, you know, before dark, take it out for an hour. If you could, like, somebody could second it right now, can you just vote on it, or do you, no, okay. All right. So anyway, but that is my recommendation for, you know, like, school shooter preparedness takes a little more, you know, work here, planning out. But I really think we should do something with the bears, because if you understand conservation, they're going to stay if the food is out. All the locals as well, you know, we know stay away from the bears, but we're also a big tourist industry. We got a lot of people, I'm sure you've seen them, they get out of their car and they're taking pictures and their kids are getting really close. So we can't have the bears staying. We got to take care of the bird feeders.
Thank you.
That's all, thank you.
Thank you very much. Anybody else? Seeing none. We will move on to agenda item 13A. Public hearing on ordinance 2026-5-32, amending Chapter 5, Administration of Government, Article 3, Boards and Commissions, Section 5-32, my best friend, the Human Relations Committee. Notice of this public hearing was made available in March 12th, 2026 issue of the Laconia Daily Sun and posted at Laconia City Hall, Laconia Community Center, Laconia Public Library, and the offices of the SAU. With it being 7:28 p.m., I will open the public hearing. Do we have anybody that would like to speak?
Mayor, councilors, Patrick Wood, Ward 1. I want to say that I support very much the ordinance and the amendments as presented. I know that you're going to be taking up the purpose a little later on this evening, and I have communicated with the city manager one error that needs to be corrected in the purpose. But one of the things I want to say is the purpose, in my mind, of the Human Relations Committee that I've been on for the last few years has been to help people understand each other and to help them learn how to communicate with each other in effective ways. And part of that means also that we're listening to one another. In my experience, all of you care very much about the city of Laconia, and you care very much about the people, especially in the city. And it's a unique situation. I think Laconia is not the average community in many ways. And I think that's proved by the fact that for 25 years we had a Human Relations Committee that really did its best to help the community. I think it's important to continue that, and I appreciate your efforts to do that. And as a citizen who's very involved in what happens in this community, I will do my best to continue to support those efforts. So, thank you.
Thank you very much. Anyone else? Seeing none, I will close the public hearing at 7:30 PM. Next up, we have an update on EMS billing and the community paramedic program from Chief Joubert. And we all have your pretty pamphlets.
Good evening, Mayor and Council. Thanks for having us tonight. We're going to review two topics that we deal with on a daily basis in the fire department. The first is EMS billing and its complexity. Both presentations are just a global overview of what it's all about. We're happy to answer any questions that you may have. But if you'd like to speak with us later on after the meeting about more specifics, please reach out to us. There's a lot of complexities involved with it. So I'm going to do what any great leader does. I'm going to delegate, and I'm going to have the people that work on this every day give these presentations. So the first presentation is going to be on EMS billing. The presentation that you have has like 10 to 12 pages, but we're not going to go over that in the presentation, just for your information. So I'd like to introduce Deputy Chief Scott Lewandowski. We talk about making a difference, and these are the people that make a difference each and every day in the city of Laconia. I think we got to have this, Scott. EMS billing. You all set?
All right, yeah. Thank you. Thank you, Chief. Yeah, so I'll try to keep it brief. So just going to give you guys a brief overview. I think we're headed in the right direction. The data is looking pretty good. So just to kind of start off, just kind of what are EMS budget funds, just in case you're not familiar. Mainly it's salaries, so my salary and the top 4 most senior firefighter paramedics. Also the fleet, so all 4 ambulances, maintenance, all the equipment in them, medical supplies. There's a lot of disposable goods that we go through on a daily basis. Training, so not only CPR training, but how to, all of our Con Ed, everything like that. And in the actual budget is actually the billing fee. So we do subcontract to a third-party billing company. So they do collect 5.5% of the revenue. So that's actually in the budget that you're looking at as well. So on that, just a couple ambulance updates in your packet. So if you remember, we did order 2 ambulances at the end of 2023. So the picture on your left is actually the first one that's finally in production. So talked to them today. We're very much likely it's going to be in service for Bike Week, if not a few weeks earlier. It's actually going to probably make its way from the factory here in a couple more weeks, and then there's some other stuff that we have to do in Massachusetts to it. The second one, I talked to him today. He's optimistic that we might see it by the end of this year, potentially. If not, it'll be the first couple months of 2027. So the lead times on new ambulances is still about 40 to 44 months if we were to order a new one. So they're a long lead time. The one on the right is our new used ambulance. So that's the one that we purchased used from Waterville Valley. It's been in service since January. It serves First Due in the Weirs District. It's a 2014 International. Thank you to DPW. They actually helped us out tremendously on the graphics. So the first time we've actually used them for that, and it turned out actually very sharp. So
looks good.
Honestly, it's a much better. Those of you that remember, we did buy another used ambulance from Franklin years past. This one is much better condition. To be honest, it's probably the best ambulance we have in the fleet right now. It's worked out really well, so thank you for that. So we get to the next one. This is kind of the nuts and the bolts of kind of where I live every day. So billing revenue. So what you're seeing as far as the $1,174,000 and change, that's what we billed out and collected physically for 2025. That's going to continue to grow. So if you looked at the projected income, that's more than likely very close where we're going to end up. So basically, year over year, we've actually, if you look at our steady increase, and I have a graph on the next slide, we've gone up about 83% over the 5-year average. So we're still trying to close that gap and make it even, but we're the closest yet at 77,000 and change is sort of where we're headed. So, and then the next page is the graph. So the important number is, because of the billing rates, we increased those a couple years ago. Billing lags a couple years, so you're always gonna see revenue coming in. We're still collecting revenue from 2022, certainly quite a bit in 2024, and then obviously a lot in 2025. It just takes a while to catch up. So, but we did improve about 35.86% last year, so that was a one-year increase. So we're certainly moving in the right direction, and we're on track this year, looking about the same, 1.3, 1.4 million. And that's what we physically collect. So we obviously bill out a lot more. I won't bore you with a lot of those details, but it's looking okay. The next slide is just additional revenue. So we do try to get as much revenue as we can. That's separate from Winnie when she comes up and talks about her program. We do some training, so we're kind of the hub for a lot of department training. So paramedics, AEMTs, we do make a little bit of profit off that. Won't go too much into it. I'm working with some state legislators. There's a federal Medicaid program that potentially could be promising for some additional revenue. It's sort of a longer game, but it could fruit a decent amount of revenue. But we're in the very early infancy stages of that, so hopefully that goes through. Call volume, so nothing crazy. We were up about 10%, 10.6% on our transport, so a little bit busier last year. Total patient contacts you see is about 3626, so that's how many people we interacted with. A lot of those are non-transport, so that includes like a lot of car accidents or people that call 911 and don't want to go to the hospital. That number's held very steady. We did go up a little bit in the mutual aid. Largely, Belmont was the largest at 57, Guilford at 26, largely because Belmont was down to one ambulance, so any second call, we did bill and collect a decent amount of revenue from that as well. So even though there was a cost and some wear and tear, we did collect a decent amount. And then we did some cover assignments as well to Meredith and Loudon. Net payer, just in case you're curious, that hasn't changed much either. Medicare is our biggest client at 50%, Medicaid 18%, commercials at 16%. And the numbers are trending in the right direction. Our commercial is actually going up, and our self-pay is actually going down. So our billing company was very excited about those numbers. So we're making good use there. And then the final thing we're going to go over real quick is really maybe the only potential action item. So not to go too much in the weeds, but New Hampshire Senate has a bill, NH 245, SB 245, which is basically kind of shaping what ambulance revenue rates are like. And we are a participant in that program, so I can happily report we are in network now. So prior to January of this year, we were technically out of network on your commercial carriers. We are now in network as part of this SB 245 bill. A part of that is they dictated at the state level what the billing rates, the reimbursables would be for the insurance companies. So I kind of did some math, and there was only two that we need to potentially look at adjusting that were a little bit lower. The biggest one that we deal with a lot is our BLS emergency rate. So that's truthfully probably the biggest bucket of transports that we do. We were a little low. We're about $262 below what we could charge for, through the insurance companies. And then our specialty care rate, not as big of a factor, but that's for any type of hospital transfers we do. So we do a few, like about 10 a year or so, where the hospital, we're kind of, if they get in a real jam and somebody's having a life-threatening, issue and they can't find anybody else, we will do that. That's where that second specialty care transport rate would come into play. So in quick math, it looks like just voting these two in should fruit us about 46 and change, 46,000 on the conservative side. So certainly up to you guys. That would be sort of where our data and math kind of looked like, and there'll be much more to come. A lot of data collections occurring right now for as part of SB 245, so that will shape kind of what we talk about in the next 2 years. Really, a lot of that's being shaped at the state level as far as what we can bill and how it looks. But I think it's a very good thing that we're in network now. That I have seen dealing with people on the phone every day. It certainly is a frustrating thing. So I think that's a very positive move. And then this SB 245 kind of builds on that. So that's really the only thing we have tonight, so it's certainly up to you guys if you want to do that on a different night, but that would just be kind of
We
our
would have to
recommendation.
address that on another night, wouldn't we?
Yeah, I'd work with Chief Juber, and if that's we can put that together as an agenda item.
I think we should.
Yep,
Yeah.
we can do that.
Counselor Bogart.
If I may, thank you, Mr. Mayor. Back to your page on the graphics, I'm not familiar when you say 16% is commercial. Could you explain that
Yeah.
for everybody?
Absolutely. Yeah, happy to. So commercials like our commercial carriers like Anthem, Harvard Pilgrim, pretty
It's
much.
insurance.
Commercial
yeah,
insurance.
yeah, commercial. Yeah, exactly. Everything else, obviously, most ambulance services are, this pie graph is very similar. We may have a little bit more Medicare and Medicaid than maybe some other communities, but yeah, the commercial seems to be widening, which again is a good thing.
Counselor Susie.
One of the things that I think is fantastic is, and I know you're gonna get to it, is the other medical services we provide where we go out under public health program or the other program, where you don't have to use an ambulance like we did in the years past. So, for example, you have the mobile health.
Oh.
Okay?
Yeah.
So that goes out, so that saves us from having to send an ambulance in many cases. Do you have an idea maybe how much that has saved us? I think it's great. I wish we could expand it, to be honest with you.
Yeah, actually, Winnie's gonna kind of cover that in a minute. She's gonna do a presentation. But I will say, I forgot to mention it. Winnie also has a new car. I didn't put it in that slide. You're gonna see a brand new Ford Explorer driving around. That was completely grant funded, so that didn't cost the city anything, and that's gonna be arriving in the next 2 or 3 weeks.
Okay, and then the other thing is, what's your plans with that fourth ambulance once the new ones come in?
So it's actually, we've already used it a couple times as a fourth ambulance. We use it probably every other day, to be honest with you. We have a lot of maintenance stuff right now as the fleet's aging. So whenever one comes out of service, we're able to bump that right off immediately, and then we're able to provide the 3 ambulances as we can. And for other events, we're able to kind of have that flexibility. So like Bike Week and stuff, we do certain special events that kind of draws from our primary ambulances. So we'll be allowed to have that flexibility. So.
I just wanted to make sure we weren't gonna go try and sell it on the market again somewhere and,
Need a backup no matter what.
No.
Yeah, thank you.
Yep.
With the 124% increase in mutual aid, do we bill at a different rate since it's out of our district? No.
We do
So-
not.
So it costs more wear and tear and more time?
We actually can't, by the agreement we're in with Lake Street Mutual Fire Aid.
Okay, good to know. I just thought it would be.
We've
if we could.
tried. I just
Yeah.
want to throw that.
I was gonna say, we
Yeah.
should be able to, because
Yeah.
that way dispatching them to
tried.
another.
Yeah.
Yeah.
Yeah, we've looked at this pretty closely. We're like I said, we're putting a lot of time into trying to close in that number, which you see we're down to 77. So I was hoping we'd be closer to 0, but
Well,
we're definitely closing it.
We're looking at these proposed rate adjustments, we might get there, so.
Is this something that we have to do?
Not today, we can't do it today, we'd have to properly notice it, and, yeah. Thank you very much. Any
thank
other
you.
questions?
Let you introduce Winnie.
Give me 1 second, Winnie. I gotta pull up the next one. All right. I'd like to introduce you to Winifred Tunstall. We call her Winnie. She is a huge component of the MIH program that we have, the Winnipesaukee Mobile Health Integrated Health Program. She's actually the supervisor of the clinical side of it, and I'm going to have her come up here and tell her story and about what we've accomplished in this program in the last year and a half.
Good evening. It's nice to see all of you. And I finally put faces to some of the names, so that's actually really nice. I'm going to go over the program and kind of what we've been doing and what we have accomplished. And if you have any questions, just let me know as I go, all right? So Winnipesaukee Mobile Health, it's with Partnership of Public Health, Laconia Fire Department, and Concord Hospital. And the goal of it is to improve patient outcomes by addressing health issues and early managing of chronic conditions, reduce unnecessary 911 calls, ER visits, and hospital readmissions, enhance care to vulnerable elder and homebound populations, integrate EMS with healthcare systems, hospital, primary care, public health, and social services, address social determinants of health that impact wellness and healthcare access. So who are we serving? So medical diagnosis such as congestive heart failure, chronic obstructive pulmonary disease, diabetes, hypertension, post-stroke and neurological conditions, wound care needs, medication, noncompliance, reconciliation, and mental health. Social, environmental factors such as lack of primary care follow-ups, social isolation, transportation barriers, unstable housing, food insecurity, difficult managing chronic conditions at home, and health literacy challenges. And then preventative and transitional care, such as post-discharge, follow-up from ED or hospital, care coordination, navigation support, palliative care needs, home safety assessments, advanced care planning, goals of care discussion, and is to avoid unnecessary emergency room visits. So community paramedicine, what is it? Community paramedicine expands the role of paramedics beyond emergency response, and we are focusing on preventative and proactive health care in the moment. And how are we doing that? So physical assessments and monitoring. We're doing that by monitoring vital signs at home. We are identifying early changes in conditions and intervening before issues escalate into emergencies. Providing non-urgent care, we treat low acuity concerns in the home. Chronic disease management, we are reinforcing medication compliance, monitoring symptoms, and helping them stay on track with their care plans. Health education, we educate patients on their conditions, medications, and empowering them to make informed decisions about their health. Addressing social determinants of health, we identify and help address barriers like health insurance coverage, financial instability, and lack of transportation that directly impact health outcomes. One of the other parts of my program is the community health worker, which I write a lot of referrals to that part and my partners. So the community health worker provides non-clinical support by helping individuals follow care plans, connect with essential resources, and complete applications. Primary program outcomes, so avoidance of admissions to a hospital or ED. We're bridging gaps in primary care, specialists, and community resources to ensure continuity of care. Avoidance of admissions to a hospital or ED. We are helping, reduction in missed medical appointments. So appointment follow-throughs, making sure that patients have transportation. If not, how can we connect them to transportation, especially our Medicare and Medicaid patients. Improvement in medication adherence. Supporting patients in taking medications correctly and consistently. We have reduction in rate of ambulance transport, so decreasing unnecessary 911 use through education, follow-up, and early intervention. Successful linkages to social services, so connecting patients with community resources that they need. The patient ability to successfully manage healthcare needs independently after intervention. So helping patients build the knowledge, confidence, and routines needed to manage their health more effectively on their own. And cost savings. Reducing avoidable emergency care hospital use and repeat services, lowering overall healthcare and public safety costs, not for only us, but the cost for the patient and their bills. One patient and real change. In 2024, one patient had 40-plus transports. After enrollment into the MIH program, transports decreased to 10 in 2025. That is a 75% reduction in 911 utilization. Since July of 2025, MIH interventions have prevented an additional 35-plus potential 911 calls. That's the data as of December 2025. And where we are now. So the program activity within 1 year, we've had over 403 patient contacts, 90-plus individual patients, 20-plus connected to primary care, and 195 community paramedic referrals for social determinants of health. And the last page is just for some of our reviews from our survey of what patients have said about us in the program. Any questions?
40-plus transports for one person?
Yes, sir.
My sister's a paramedic in New York City, so I know there are some patients like that, but that's pretty excessive. So I'm glad to see that number go down. Saves taxpayers money, too. Councilor Bogut.
Thank you, Mr. Mayor. On this page,
Yes, sir.
it might have been said somewhere else, and forgive me for my ignorance, but what is MIH?
Mobile Integrated Health.
Okay, thank you.
You're very welcome.
Councilor Hildreth.
Excuse me, I just want to say that this program is tremendous for our community. Chief Joubert and I spoke about it last year, and I was really, really impressed. And I think at that time, other communities, other cities were looking at mirroring Laconia's, larger cities mirroring Laconia's successes in this. Thank you very much.
Thank you.
Councilor Susie.
Couple of questions. How many people are on your staff right now?
On the community paramedicine program side, it's just me.
Just you?
Yes, sir.
Okay, so you're, in other words, our coverage is roughly, what, 40 hours a week or thereabouts, or?
We'll say thereabout.
Okay. I understand. And I know the program is funded for another year.
Yes, sir.
Okay. Is there, I've heard some opportunities maybe that the program's gonna get funded additional dollars maybe, or you put in for additional to increase the time frame or the availability?
I think moving forward, we're looking at ways to grow the program.
Right.
And looking at all the opportunities that are possibly there. And I think we work right now with Partnership for Public Health. It's a team effort, right? So the community health workers are really affiliated with Partnership for Public Health, but we wouldn't be in this position without the Partnership for Public Health. So together, we want to keep this moving forward to try to grow and expand. Right now, Winnie can only really treat Laconia residents.
Oh.
Where other parts of that can go outside of Laconia. But I do think, working together with PPH and other avenues, we can definitely grow this program because there is a need for it, for sure. And I know that we talk about the mistransports, but one of Winnie's biggest strengths is she's such an advocate for her patients. Those people, Mrs. Smith, who doesn't want to leave her house but really needs medical care, she makes sure she gets to where she needs to go to get that proper care. So it's working out really well.
No, I'm just trying to lay a foundation that we need to grow this and put more resources into it so that, I mean, I assume, I shouldn't say the word, but other towns and cities around here are trying to duplicate our program, okay? Or maybe, I hate to say this because I don't want to give anybody a lead in and make it part of mutual aid, but, stuff like that. And I've seen it in action with a couple of people I know, and I just think it's awesome, and I wanted to thank you very much.
Thank you. I will say, going to the state meeting for MIH Mobile Integrated Health, that there are right now in the state of New Hampshire 5 active programs. The last meeting that I went to, there was 14 of us, so it is picking up momentum, and there are other towns and counties starting to look into it that came to see what the active programs are doing so that they could see how they could start their own. So you are right, it is starting to gain more popularity and grow.
And as the chief said earlier, you're getting a new hot rod soon, right?
I'm trying, I'm hoping.
Councilor Conan.
Yes, Winnie, I would like to say thank you very much for what you do. It's, we're very lucky in Laconia to have this program. And as Councilor Susie said, I hope we can expand upon it and maybe perhaps clone you. So thank you.
All right. Thank you very much. We
Thank
all
you, guys.
appreciate you.
Have a good night.
You too. Next up, we have Mayor's Report. Really, nothing new going on. Still assembling the homeless subcommittee, and that's really the focus right now. Had a lot of private one-on-one meetings I can't discuss here, but things are looking good. We can go on to council comments. Anyone have a comment? Councilor Susie?
One question,
Yep.
I was just recently by there earlier today.
Yep.
Well, city manager's not here.
Oh.
I was gonna ask him for an update on Parade Road and Roller Coaster Road.
You could ask him in a few.
Okay, I know, John, it's, and I see that area, and it's,
It's beautiful.
oh, yeah. Yeah, we should have an antique party there or something,
Councilor Conan.
I'd like to expand on what Councilor Susie just said. I know we had our goals session and we discussed some things, but cleaning up the neighborhoods, that being one site in particular, there's 2 that I've issued to code enforcement to try and clean up. I mentioned the box truck on Elm Street. So I'd like to have the city manager let us know what the progress is on those and how long we can expect before we can see, after issuing warnings to these folks, when can we expect cleanup?
Oh, look at that timing.
Yeah.
You're about to get bombarded. Yeah, you might want to go to the bathroom. So they had a question about Parade Road and Roller Coaster Road.
Yep, so Parade and Roller Coaster was, we were supposed to be on the property, we were denied being on there. When we went with the warrant, we're going back with an additional warrant. The problem was the time frame. It started snowing right as that was supposed to happen. So the cleanup crew is like, look, I can do this, I could try to do it, but it's not gonna do what you're looking for me to do. So it'll be back out there in the spring, so that's where that stands.
And the Elm Street,
Yeah, so, I'm sorry, Mr. Mayor. Bob Susi, Councilor Susi brought that up, and I know that's been an ongoing issue. I've submitted a couple more, yeah, the Parade Road
Oh, okay, yeah,
issue.
yeah, yep.
But I've also submitted a couple of requests from the citizens through code enforcement for cleanup, and just trying to get a picture of how we can expect that to shake out and when we might see cleanup actually happen.
Yeah, I can talk to them to find out which ones they were and what the locations were and get you an answer on what the timeframes look like. Sometimes they're quicker, sometimes they're not. Sometimes if it's gonna require us to get, court interaction, it certainly delays it. One of the things that we, this goes back probably 2.5 years now. We were able to streamline our process, at least to get into court, which has cut our time frame down a little bit, and also is a little bit less expensive than the process we were doing. It's a good thing, but it does speed up a little bit, but it's not perfect. But we have had some successes, and every time we have a success, we get a little bit better with doing it. So I'll get the addresses from them that we're working on, and I'll get you an answer.
Thank you.
Councilor Bogut.
Thank you, Mr. Mayor. This is more for the public. I would like to ask the public in general to have patience as we go through mud season and frost heaves and potholes and stuff are revealing themselves, and give us an opportunity and give our DVW an opportunity to fix these, because I cannot count on my hand one street that doesn't have an issue. So please give us patience. We're aware of it, and we're trying to address it all, but we have to wait for the frost heaves to stop before we could actually start doing anything. Thank you.
Councilor Hoffman.
Yeah, I just wanted to address the gentleman that spoke earlier about his situation with the adjacent property. I mean, obviously, there's been some kind of breakdown of the bureaucracy here, and he spoke to us several times about this issue. I'm just wondering, is there literally nothing the city can do to resolve this issue? Is this totally in the hands of the courts at this point, or?
I don't want to go too deep into it because we are in court with it. Well, potentially will be, but yes, even with working with our attorney, with the attorney that represented the Building Code Board of Appeals, yes. The short answer is to yes. But I think we've also tried to avoid that as much as we can. I really do. But that may be where it's headed.
Then I guess my next question is, how do we make sure this doesn't happen again?
Well, it doesn't necessarily mean we're not. When you go back and talk to fire, who does all the code stuff, that they are saying that they interpreted the code correctly. So to say we go back and do something different, if we're interpreting the code correctly, then we didn't. That's not a correction. To try to help him get to this point, I think we really worked hard to try to do that, to get him to a good point, not to, hey, go to court, I know he has mentioned that before, that it was said very early on in it. I think that we really tried to avoid that. I'm not saying what he was said or what he wasn't said in previous, but as I worked through with him, we really tried to avoid that for as long as we could. I don't want to do that either. I don't want to go to court either. We certainly, that's not something we sit in the office and try to do. So we try to avoid anything we can.
Well, it sounded like the court system did not give him the resolution he was looking for.
That was the Building Code Board of Appeals.
I see.
So which is the first step. Their ruling determined that hadn't appealed within the correct time frame. So that's where that was.
Okay, thanks.
All right, on the committee reports, are there any committee reports? Seeing none. Any liaison reports? Seeing none. Now we're on to citizens' requests to comment on current agenda items. We're going to keep this to 2 minutes, if anybody would like to speak.
So, Mr. Mayor, councilors, Patrick Wood, Ward 1. I'm talking about the proposed purposes for the Human Relations Committee. As I say, there was one editorial correction in the first sentence, which I believe the city manager has sent to you all. And what that does is explain that Yom HaShoah is the Holocaust Remembrance event and Kristallnacht is the Night of Broken Glass. There are other things that obviously would be a part of that. I think it's going to be important that we be somewhat flexible as we learn some of these things, but I received a text this afternoon from someone who is running for Congress, and his text quoted a threat that he received from the chairperson of the Libertarian Party. Being hung in public is better than you deserve. Now, that type of language is not acceptable to any of us. It's not what we should be dealing with in any political situation. You all know that, I know that, but unfortunately, that's what we sometimes have to face. And so as we consider the purposes of this Human Relations Committee, I'd ask you to keep in mind that our goal is to try to reduce those types of responses and those types of threats. So that's the purpose of the Human Relations Committee. And sometimes it isn't pleasant to have to deal with those things, but we do. We can't have that as being the standard for political discussion. So, thank you.
Libertarian Party doesn't surprise me. Anybody else? Seeing none, we will move on to the city manager's report.
Thank you, Mr. Mayor. Start off with our Laconia project update. So as we come into spring, we certainly know that we have a list of roads that would go through a full need for update and repair. It's going to be based on what we have for remaining money from last year that we rolled over, plus whatever we end up coming up with for the new fiscal year that we're starting to work through that process now. One of the things that it says on there, it talks about an extensive road patching throughout the city. I wanted to expand on that just a little bit. So what that isn't, is it isn't the cold patch, throw down, tamp it down where it goes away in a couple of weeks of driving. They have a program that they're working on. It'll be the first time that we've implemented it in the city. It's an infrared heater system that actually, I'm not sure which brand they're using, but if you look up infrared heaters for asphalt, there's pretty good videos online you can find. It actually essentially turns the asphalt back into a liquefied asphalt. So when they go in and they smooth it out, repat it down, add some new material to it, and instead of having a patch, what you really have is it's integrated now and built into the asphalt that's there. I think it's going to make a big difference. It's going to take a lot of time. Our DPW guys will be putting a lot of effort into that, but I think it's going to make a big difference. I was really excited when I heard them talking about that program today. So, it'll be a first time we try it, but hopefully it does well for us. Weirs Beach Bridge, the Weirs Boulevard Bridge. Looks like we're looking at a little bit of a savings on that as of right now. As we all know, early into a project, savings sometimes don't last the whole project, but they're looking at that. Winnipesaukee River Basin Project, we've talked about this quite a bit. Both bills are still moving through their chambers down there in Concord. One of it is to decrease the replacement fund from the 5%, 2% that we would have to pay. And the other one is to look at the Winnipesaukee River Basin as a whole and determine, forming a commission for that with a director of it. And so there's a lot of changes that are going on. But they are moving through down in Concord. We do see a sewer system collection repair coming up on White Oaks Road again. I know they were up there before. This is going to be going north about 2,000 more feet. The plan as of right now would be to wrap that up prior to Motorcycle Week. We always do that. We try to, that's one of the roads we have, good and available for the riders anyhow. But the plan is to have that done by Motorcycle Week. I asked how much of an impact it's going to cause. As we remember last year, there was a lot of work that went on in that section up there. In the area that they put in last time, it was about 1,000 feet, but it was mostly ledge that they were going through, so it was a lot of extra work to get through the ledge. This has probably some ledge to it, but they feel that it's very minimal in the distance of it, so it shouldn't be, knock on wood, but it shouldn't be as invasive as it was before. The Laconia State School update. The biggest thing with the state school that we're working on right now, you saw the presentation from them, I think it was last meeting, is the sewer system that runs through there. They are their own community within it. We're working with our attorneys, their attorneys, to determine what the best is, whether we're going to take over and that just become another part of Laconia or something different. Most likely, that's the direction we're going to look at. We have the capacity for it, which is great. But the other thing is, whatever we do with that is going to be no cost to city. So if we're to take that over, we're going to all the money we'll bill to get our money back. So we're not. There's no increase to the current rate users, if just per se. That would be the best way of saying that.
Council Susie.
If you do that, and I'm in favor of that because they've done all of our standards and everything else like that, would you also have a link so that you can use that same system and we can expand our own system up further north?
Well, that would be our system. So,
So in
yeah,
other words,
I mean, we could,
open up the other
depending
side
on
of
what
James
our total capacity looks like and all that, yeah.
Okay.
That would all be a math problem.
Okay, because I'm just looking at that for both sewer and water.
Yeah, and I know that sewer and our water both have they have some engineering ideas on what it would look like to expand out there and.
Go north a little bit more. Okay, thank you, Mr. Mayor.
Councilor Bogart.
Thank you, Mr. Mayor. So I can test my understanding. The sewer pipes that's going to go into the state school redevelopment are villages of Laconia. Those will be Laconia pipes, not like South Down.
Correct. They're going to be doing the infrastructure, but it'll become our pipes.
Right.
Yeah.
Okay.
And then we
this-
will bill, just like they were any other houses in community. So,
We don't anticipate this turning into a South Down.
no, it'll be a different.
It'll be an open community portion of the community of Laconia.
Correct.
Just be another neighborhood.
Yep.
A little larger, but.
They actually want it that way. They want it to be just another neighborhood with that everybody can go to. And one of the things I'll just mention real quick is we do run into issues that are from a long time ago of some sewer issues, some water issues, relationship between city and private. We don't, not that we would ever not make those mistakes again, but we certainly identify a lot of those issues much earlier. Road ownership, sewer ownership, water, all those things that weren't always identified early. Before they even put a shovel in the ground, we've having these conversations. I've had these conversations with the state school for 2 years now over those ownerships. So we can work through, so the reason we're where we are now is because we've worked through these problems.
Thank you.
Couple other quick items that weren't on my list, but I added them to it. Social districts. I was asked at, I think, the last meeting, just kind of give an update. Meeting tomorrow with the Public Safety Committee. The goal is going to be to finalize the map, have a draft plan of the management and maintenance of the social district to be able to have in front of you guys in the, as early as the 2 April meetings to vote to get something finalized. So as long as the Public Safety Committee works on that tomorrow, I don't see any reason why we can't have that done. The lighting project for the City Hall, smaller lot, and then Rotary Park, we did receive our packet back today from the engineers. It's missing one piece. They're still working on it, the actual dollar figure. But we finally got it back today. They know that. They're waiting on a couple of vendors to give them the final pricing. They just wanted to give us something, so we'll have some pricing. I'm not gonna say hopefully at the next meeting, but, because I keep saying that. But we really want to get this done. We know that we need to build this into the budget season if we're gonna do anything. So, we've been pushing them pretty hard to get to this point.
May I, Mr. Mayor?
Counselor Bogut.
Thank you. Thank you, Mr. Mayor. Did they do an estimate of construction time? Of
I
how
haven't seen
long?
it yet. It just came in this afternoon. I
Okay.
haven't even had a chance to see it yet. Their plan was to have it in on Friday so we could review it over the weekend and have something to talk a little more about. They got it this afternoon, so it was,
That's fine.
yep. The Boardwalk project, for the bandstand that I had been asked to put out for an RFP, we got no responses back. So they're gonna adjust the scope, send it out one more time, see what we get back. We got a response back from New Hampshire DES on the Guilford gas station issue. It came back pretty quickly. Gave me a whole list of people that are working on it. They're planning on coming out to actually put eyes on the site and then give me a response letter back to be able to share with you guys. I just haven't got that letter back, but it got everybody's attention.
They're on it.
Yep. And the other thing I just want to mention is, you had your goal setting. We are working on compiling all that and getting that ready to present to you. The day afterwards, we had our department head meetings. Of course, they were all in to listen to it. And it was fun to have the meeting with them, and they're already like, hey, they talked about this, and this is what we can do, and I can do this in my department. So it was a nice spurred conversation, and so we were really happy with that. The only other thing I have is on the second page. It's very uneventful at this point of the year. It's the CPI number. It did not change month to month. A little bit odd. Usually it changes at least a point here, a point there. So we're at 2.4% looking at next year. That's all I have, sir.
All right. We are on to new business. Request to renew the Robert A. Hamo Community Service Recognition Award Committee. So in September of 2024, Laconia City Council created this committee, and it basically gives an award out every June. So I'm going to move to renew the Robert A. Hamo Community Service Recognition Award Committee as requested. Councilor Conan, seconded by Bogert. Discussion.
Can I just throw something in?
Yes.
Just want to talk. You'll be looking for a sort of a fresh set of names.
We're gonna keep some, yeah, we're gonna
So
keep some, yeah.
You'll work on the name issue.
Yes.
Perfect.
We'll get that done within the next few days, probably.
Thank you.
Yep. Any other discussion? Seeing none, all in favor? Up, you missed what?
I missed the motions.
Oh, I made the motion.
Yeah, right at the bottom of
Did we get the first and second?
I
first,
I second.
Yeah, yeah, oh, I'm sorry, okay.
Thank you,
yeah.
Dennis. Just who's it?
All right, we're on to unfinished business. Agenda item 22A, ordinance 2026-5-32, amending Chapter 5, Administration of Government, Article 3, Boards and Commissions, Section 5-32, Human Relations Committee. I move to waive a reading of ordinance 2026-5-32 in its entirety and to read by title only. Councilor Bogut, seconded by Councilor Susie. All in favor? 6-0. I move a second reading of ordinance 2026-5-32 relative to amending Chapter 5, Administration of Government, Article 3, Boards and Commissions, Section 5-32, Human Relations Committee. Counselor Hoffman, seconded by Counselor Susie. All in favor? I move to approve ordinance 2026-5-32 relative to amending Chapter 5, Administration of Government, Article 3, Boards and Commissions, Section 5-32, Human Relations Committee as presented. Counselor Hildreth, seconded by Counselor Hoffman. Now we get to have discussion. Counselor Susie.
When I see in here, the only thing, I just want to make sure, okay, that the procedure process works correctly. 7 members, 6 council appointments, 1 mayor's appointment. I think it's great. I'd just like to make sure that if this passes, I can work with Nancy to get, a notice in the paper and that kind of stuff, notices up in the proper places, so we can start the interview process of people that want to apply for that to come through the.
So is this an
committee, so
interview
then we can-
process, or is this an appointment process?
No, we're gonna have them go through the normal appointments
Okay.
process.
That's what I
And
mean.
we're ready to put it out. We've just been waiting for this to be tightened up.
Right.
Okay.
I just want to make sure everybody's clear on that. Okay? That's the reason why, Mr. Mayor, okay? Thank you.
Counselor Bogan.
If I may, I think the intent was the 6 would go through the appointments committee, and then the mayors would not.
Yeah,
And so,
that's correct, that's right.
Yep.
The
Okay.
mayor can appoint somebody that,
and the
a
mayor's
local citizen.
runs with the mayor's term,
Yes, correct.
so.
I like the way it's staggered, so,
I mean, it's real good.
and we didn't make it too big either. 13 was pretty big. Any further discussion? Seeing none, all in favor? Wow, 6-0. All right. What did I just do? Oh, I don't have a B here. Hold on. At 22A, I don't have a B. Oh, you got it. I don't have it. So we are going on to 22B. Agenda item 22B, Human Relations Committee, the purpose statement. We've had a lot of discussion about this, so I move to approve the Human Relations Committee purpose statement as presented.
I could just say something before you do that. You were given a new one that adds a word to it. It would just save you a motion in the middle from amending it. As opposed to what's on there, we added the words Yom, and I apologize if I'm, Yom HaShoah, into the, before Crystal Knock in the statement.
It's in red.
It's in red on
Yeah.
yours, and the city clerk has one. Just want to make sure you have it, that's the only thing we have. So you
Any
can use that as
objections
the
to
as
that?
presented.
Counselor Bogut?
Are we discussing this? now?
No, we still need a motion and a second.
Okay,
Make a motion.
Counselor Susie,
I'll second.
Counselor Bogut, second. Now we can have a discussion.
I just wanted to clarify something. I've had some questions that came up because we wanted all language coming, all speech coming from this committee to be approved by the council. And then we put another line in there, and the intent for the city manager to approve was for that rare occasion that the city council can't meet to approve a statement. So it's that rare occasion that the city manager, we trust our city manager to make that right decision based on his experience with the city council.
I just don't understand how there would be an occasion that important that, I mean, a week or would make a difference, but that's just,
It could be a shooting that happened over the weekend or
but
something along
should we
that.
be releasing statements before we know all facts pertaining to that situation?
And the
Are we
city
jumping the gun?
Right, and the city manager's also gonna speak from, as he would today, I would hope, okay? The lady that came up earlier, okay, I'll use that for an example. She talked about school shootings, and I know from being involved with it, okay? The police department's conducted school shooting exercises in all the schools, both private and public in the city, okay? And aware of that, set up responses, and they're gonna put the access, programs into it and all, okay? But something happened, I would expect that the city manager and the police chief would probably have a statement they would make, okay, and saying, and if it looked like it was human relations, or whatever you wanna call it, focus, they're gonna come out with a statement that's gonna be
On behalf of the city.
on behalf of the city, and I think that's what would cover it, okay? I have complete trust in our CEO, you might say.
Yeah.
Yeah, I'm just saying, I don't see any situations where that would even really happen, because there's nothing that urgent, in my point of view, that you have to release an immediate statement, and if it was, it would be coming from the city itself, not a subcommittee of the city.
That's right.
Councilor Bogan.
I hear you and understand that, and I don't think that it's a deal breaker if the city manager, that sentence is extracted from the statement. I'm looking at Councilor Hoffman, who is also the committee member, and we discussed all this, trying to cover every avenue. But I personally don't see where, and I hear what you're saying. So I don't have a problem if that is extracted from the purpose in order to get this across the goal line.
I mean, I'm gonna be honest with you, with our form of communication, and as well as the city manager communicates, and we communicate with each other, if it was something that urgent that they really wanted to push for, they could still email it to us, and we could have 91A, but we could still have that opinion. If it was something, oh, I need this done within the next day, we need to make a statement on this. I think we're all quick enough on our emails and responsive enough to be able to okay that without having to go bother Kirk, who's busy
And I
enough.
trust what he's gonna, our CEO, whoever it might
Yeah.
be, I trust Kirk, but you never know what's gonna happen, but I mean, and if we can't, then we have to have a different discussion.
Yeah.
And as long, that would work, as long as everybody understands you can't reply all to those
Exactly.
kinds of,
Councilor Hoffman.
I think the intention of this is, we want to give the committee, if the committee feels that they need to make a statement on something immediately, there's at least an avenue, a process for getting that statement approved.
I just don't see urgency, anything that important that, if it was that important, the city would be making a statement as a whole, not a,
We've been asking
Yeah.
our lawyer to make this.
yeah, exactly, yeah.
Well, I think maybe some things that might seem important and timely to the Human Relations Committee might not.
Be important to the rest of the world.
so would I make a recommendation that someone make a friendly amendment to modify that, if that's the will of the council, to remove that portion,
What portion are you talking about?
allowing the city manager to make that decision?
Why would we remove that?
You
I
were
don't
just giving
understand.
me arguments on why not to put that in.
All I wanna do is make sure we're giving the city manager, if he wants to make a statement.
That's different.
That's different.
Okay, okay.
That's
okay.
completely different. Yeah.
Not to interrupt, but I mean, I would still release any press release or statement as, that I'm allowed to do, so.
Yeah,
That's
exactly.
different.
I'm okay with
Yeah.
it.
So do y'all want to leave it in or take it out? I've got mixed,
I'd rather leave it in, but I'm okay taking it out as well.
Anybody want to take it out? Anybody want to leave it in?
well, it sounds like it's
Councilor
stayed.
Conan.
I just want to say, I think as a council, we trust that our city manager, if something would arise, would be able to speak on our behalf. I think it protects us from the newly formed Human Relations Committee from making their own statement.
Well, they wouldn't be able to.
They won't be
They
able
have to be approved by the, so we're saying this, by removing that, by removing the city manager from the equation, they would just have to wait to the next city council meeting for us to approve, or we could do it via email to approve their statement. I personally don't think of anything that urgent, and if it was that urgent, we'd be releasing a statement as a council, as a mayor, as a city, as a whole, not a subcommittee. So if it's something they want to release a statement on, I kind of feel like the whole council should have input on that. Nothing against Kirk, but I think we should all be able to discuss that and make sure it was appropriate, that we're not jumping the gun on something without all the facts in place and everything pertaining to that matter.
So once again, I ask, is that a friendly amendment?
So which clause in here are you relating to?
It is,
The first, second sentence in, D.
The city manager may authorize a speech and its content, is that what you're trying to take out?
That's what's being discussed. If at times does not allow for prior council approval, the city manager may authorize the speech and its content. Now, we're
that's fine.
talking about,
I-
the thing you gotta remember is, it's not today or tomorrow, 5 years from now, when everybody's different, if everybody is different, then, so it's not just
we
for
might not even
today.
have the same city manager in 5 years, or,
Who
yeah.
knows, but at the same time, if whatever the council is, if whoever we're gonna have as a city manager, whatever it is, if you can't trust that person, there's a bigger problem here.
But this is different. This is a committee putting out a statement.
We don't want the committee to, I want the city
Well,
manager
yeah,
to.
no, but they are gonna ask for approval from him, not the full council.
Okay.
To put out a statement. So we're kind of bypassing the council as a whole for them to put out a quote-unquote emergency statement, which I really can't think of anything that urgent where,
Like, and I understand,
I mean,
and if it was
I can
something that
understand that.
serious, the city manager, the police department, or the fire department would
everybody,
make that
everybody else is
statement
putting out a
already.
statement, or as
So-
an individual, not as a.
I
yeah.
can understand that.
So, Mr. Mayor, can I make that friendly, or would you like to, Counselor?
I make a motion, a friendly, well,
Amendment.
a friendly amendment to modify and remove that statement of times as is not allow for prior council approval, the city manager may authorize a speech and its content be extracted from, Section D. And Section D then should say the Human Relations Committee may not speak publicly on behalf of the city or present present any content without city council approval, period.
So the council as a whole would be approving it, not the city manager. I think that gives 6 voices is better, no offense, Kirk, 6 voices is better than 1.
So that's my motion.
Your friendly amendment.
Yeah.
And Mr. Susi, Counselor Susi.
I still am struggling with it because, and I understand where you're going, but I also have complete trust in the city manager. Now, you said, I agree, 5 years from now, we could have a different city manager, a different council, and everything else like that. And that's the thing, I don't wanna lay
Handcuff
that
'em.
groundwork,
Yeah.
okay? I guess my question would be.
The
and,
city
I don't
manager-
wanna put this either, because I was gonna say, Mr. Manager, how do you feel about that?
You want my opinion? I'm okay with the striking.
Okay.
I'm gonna release, if there's something happens tonight, in the middle of the night, I'm gonna be releasing a statement. Regard, if it,
Yep,
so.
no matter what, right.
So, that's different than, so.
Then I'm okay.
I don't think this, but, certainly would wanna work with them, with Human Relations Committee on crafting the language.
Yes.
And then working with you guys on their statement. I don't have an issue with it.
Okay. I accept your friendly amendment.
Okay. Who seconded?
Who did second it?
I don't remember.
Nobody did.
Nobody
think-
seconded it? And we're in
I
discussion,
think
are we?
Counselor Hoffman
Oh,
seconded
Counselor
it.
Hoffman.
Yeah, I accept the amendment.
All right, any further discussion? Seeing none, all in favor? 6-0, look at that.
No
We
boxing
got that done, yeah, no boxing gloves. No, that's only for fun, that's for charity work. And that would be it, we can
Mr.
adjourn.
Mayor?
Oh, Counselor Bogan.
If I would, I'd like to ask to have a non-public session under E, a 91-A:2, 3, Section 2, number E. For tonight, just about 5 minutes.
Okay.
Can we do that without prior posting?
No, it's a non-public session, so we have a motion to go into non-public session. It's 8:29, we're going to close, well, we need to vote first. Everybody in favor of going into non-public session?
First, we need a motion.
Oh, well,
I made the
Bogan
motion.
made the motion. Oh, we need a second.
Second.
Seconded by Counselor Conan, sorry.
Promise you 5 minutes.
No, we don't know.
Now we have a roll call.
Counselor Hildreth?
Yes.
Counselor Susie?
Yes.
It's not even on. Counselor Hoffman?
Yes.
Counselor Haynes?
Yes.
Counselor Bogart?
Yes.
Counselor Cronin?
Yes.
Okay. So
All right, we are now closing the public meeting and going into a